Hi there, Heidi. How are you doing today?
Oh, doing fantastic. Thank you.
I'm glad to hear that. So, if you could just introduce yourself for us quickly, we'll give you a little bit of time to give us your name, your title, a short bio about yourself, your credentials, and then the title of your article.
Very good. Well, as you have heard, I'm Heidi Cross. I am a certified wound and ostomy nurse and also a board certified family nurse practitioner. I've been doing wound care for over 20 years and really have a real passion for it. Currently, I do wound care consults in nursing homes as well as at the University of Rochester Strong Memorial Hospital. And I wrote an article for the American Nursing Journal called Skin Failure, A Historical Perspective. What I attempted to do through this was to depict skin failure through the ages, starting with ancient Greeks and Romans and their idea of what skin actually was, working our way through to the period of Jean-Martin Charcot, who in the 1800s realized this phenomenon that quite often just before patients die, they exhibited kind of a butterfly shape ulceration on the buttocks, maybe unilaterally. What does that sound a lot like? Sounds a lot like our current Kennedy terminal ulcer or Kennedy lesion, like we've transitioned to saying. So I decided to take a closer look at the issue, especially with my interest in history. Another thing that I do with the article is perhaps introduce you, unless you already are aware of this technology, kind of a new technology called long wave infrared thermography, LIWT for short. And that's actually a thermography technology that will show you what exactly is going on beneath the skin. For instance, with Kennedy lesions or the terminal ulceration skin failure, there will be no change in color with this thermography, whereas there will be a change in color with pressure injuries.
That's fantastic. So, you said that you were a little bit of a history buff. What specifically made you want to write an article on this, not just the history side of it, but in general?
Well, it's obvious, I think, to myself and many other healthcare providers that this issue is becoming more and more prevalent. We have now the aging of America with its concomitant frailties, greater number of elderly approaching end of life. But you need to realize, when you read my article, that we're not dealing with just end of life. We're also dealing with perhaps chronic skin failure, which is described in an article that I highlight in my article. What that means is skin failure associated perhaps with chronic conditions that really stress the skin. Also, there is such a thing as acute skin failure, which can occur during critical illnesses. And COVID certainly didn't do us any favors with that. We're talking about those critically ill patients who are in respiratory failure, maybe concomitant cardiac failure, kidney failure, etc. And we really don't have any real guidelines. We need a lot more research pertaining to this subject. My hope in writing the article was that with a greater awareness of the issues and knowing historically how we got here, nurses will be better prepared to recognize the possibility of skin failure in their patients and in their practice.
That's fantastic. And with such an important topic, obviously nurses should want to read this. And I know that you want nurses to read this article. So could you briefly give an overview of why they should and two to three things that they should really take away from a topic such as the one that you're presenting to us?
Sure. Well, with my interest in history, my passion for wound care, my definite interest in skin failure, it just seemed like a logical step for me to do, to look at this issue. It helps too that I do a lot of legal nurse consulting, which means that I, as a wound care expert, look at charts for attorneys. And a lot of the cases that I look at involve critically ill patients. Maybe they're elderly, maybe not. They're in the ICU. They're in respiratory failure. They're in those other organ failures I mentioned, like cardiac failure or kidney failure. They have a lot of chronic illnesses, perhaps, and frailties. So, accepting the fact that we have these other organ failures, we of course know that skin is an organ, just like those other organs, Who are we to say that skin failure can't occur? And I maintain that it does. Also, skin is our only visualizable organ. Someone develops spectacular skin breakdown on their buttocks or wherever that can be so shocking and horrifying to their loved ones. They jump to the conclusion that their loved one has been neglected or abused, and voila, you've got the perfect storm for a lawsuit. 2 to 3 things, although I have more, that I'd like nurses to take away from this article. Beyond the appreciation of the history and also introducing the new technology that I mentioned, the LIWT or LWIT, I would like to think that I give you some really good takeaway points, which really ultimately are questions that I raise versus really not providing you so many answers. There are just so many important angles related to this topic. Ethically, how do we know that ethically we are best serving our patients? How do we know when maybe it is time to stop any aggressive interventions? How can we best discuss these issues with the loved one and make them with the loved ones and make them aware that perhaps improvement is not a possibility here? Clinically, where do we turn to provide turn for guidelines to provide the most evidence-based care? How to best care for our patients? That always leads us then to the discussion of what about our healthcare policies? What healthcare policies need to be discussed? What healthcare policies do we as professional wound clinicians need to advocate for? And then, of course, healthcare policies, you can't talk about that without talking about regulation and reimbursements. We need our regulations to be consistent and in sync with the clinical realities that we as wound clinicians are facing. And yes, reimbursement. We want to be adequately reimbursed for what we provide. And then last, legally, unfortunately, so much of our time and resources is tied up in lawsuits in this country, time and money. Perhaps how can this knowledge that's in my article with all of its references, which hopefully you will check out, how can this be helpful to you and your practice? So in my mind, this was really a very timely and important topic to be discussing, and that's why I wrote this article. Hopefully you find it helpful and informative, and thank you for your time.
That's amazing. It seems like you put a lot of thought and effort into this, and we appreciate you writing this for us. And nurses absolutely should check out your article. So thank you again for writing for us.
Okay, thank you for having me.
Have a great day.
Hey, you too, Andrew.